Have you ever noticed your discharge changes throughout the month and wondered if that's normal or something you should worry about? Here's the truth. Discharge is supposed to change. It's one of the most reliable signals your body gives you about what's happening hormonally day to day. But somewhere between this is normal and this needs a doctor, a lot of women get stuck because nobody actually explains what's happening phase by phase. So in this video, we're going to walk through exactly how discharge changes across your cycle and, more importantly, the specific red flags that tell you something isn't right. By the end, you'll know exactly what to expect from your own body and when it's time to get checked. Let's get into it. First, let's clear something up. Discharge isn't a problem, it's a function. Vaginal discharge is produced by glands in the cervix and vaginal walls. Its job is to keep the vagina clean, maintain a healthy pH, flush out dead cells and bacteria, and, very importantly, help or block sperm depending on where you are in your cycle. The consistency, color, and amount change because your hormones, mainly estrogen and progesterone, are constantly shifting. So instead of thinking of discharge as one normal state, think of it as 4 different normal states, one for each phase of your cycle. Right after your period ends, discharge is usually minimal. Some days you may notice almost nothing at all. This is sometimes called the dry phase. At this point, estrogen levels are low, so cervical mucus production drops significantly. It's completely normal to feel drier than usual here. This can last anywhere from 2 to 5 days depending on your cycle length. Red flag check. If this dryness comes with itching, burning, or irritation, that's not typical. That could point toward irritation or early infection, which we'll cover shortly. As you move further from your period, estrogen starts to rise. Discharge becomes more noticeable, usually white or slightly cloudy and sticky or tacky in texture. This is your body preparing for ovulation. Think of it as a gradual buildup. Your cervix is starting to produce more mucus to eventually help sperm survive and travel closer to ovulation. At this stage, mild changes in texture from day to day are completely normal. This is the phase most people notice the most, and for good reason. Around ovulation, discharge becomes clear, stretchy, and slippery, often compared to raw egg whites. This is peak fertility. The stretchy texture actually helps sperm travel more easily toward the egg. If you stretch it between 2 fingers, it can stretch an inch or more without breaking. That's a completely normal, healthy sign of ovulation. This phase usually lasts 3 to 4 days, and many women use this as a natural fertility tracking signal. After ovulation, progesterone takes over. Discharge usually becomes thicker, white, and creamier again, similar to lotion in texture. As you get closer to your next period, some women notice it decreases again or becomes slightly more sticky. This entire pattern, dry, sticky, egg white, creamy, dry again, repeats every single cycle. That rhythm itself is a sign your hormones are functioning normally. Here's the expanded red flag section with full clinical mechanism detail. This will push the section from around 2.5 minutes to roughly 5 to 6 minutes, so total video length lands around 15 to 17 minutes. Script style kept consistent, no bracketed stage directions, formal but accessible English for a general reproductive health audience. Now, here's the part that actually matters most though. Knowing when a change means something's wrong. Let's go through the major causes one by one, what's actually happening in your body and how each one presents differently. BV is the most common vaginal condition in women of reproductive age. It happens when the natural balance of vaginal bacteria shifts, specifically when protective lactobacillus bacteria, which normally keep vaginal pH acidic, decrease and anaerobic bacteria overgrow instead. Normal vaginal pH sits around 3.8 to 4.5. In BV, pH rises above 4.5, creating an environment where odor-producing bacteria thrive. What this looks like: Thin, gray, or white discharge, often with a strong, fishy odor that becomes more noticeable after intercourse. This happens because semen is alkaline and temporarily raises vaginal pH further, intensifying the smell. BV is usually not itchy, which is one way it's distinguished from a yeast infection. BV isn't classified as an STI, but sexual activity, douching, and antibiotic use can all disrupt the bacterial balance and trigger it. This is caused by an overgrowth of Candida, a fungus that's normally present in small amounts in the vagina. When something disrupts the balance, antibiotics, high estrogen states like pregnancy, uncontrolled blood sugar, or a weakened immune system, Candida multiplies rapidly. What this looks like? Thick, white, clumpy discharge, often compared to cottage cheese, with little to no odor. The defining symptom is intense itching and irritation of the vulva, sometimes with redness and swelling. Unlike BV, discomfort is usually the dominant symptom here, not smell. This is a sexually transmitted infection caused by a parasite called Trichomonas vaginalis. It's one of the most common curable STIs worldwide. What this looks like? Frothy, yellow-green discharge with a distinct foul odor, often accompanied by itching, redness, and sometimes pain during urination or intercourse. Some women have no symptoms at all, which is part of why regular STI screening matters even without visible signs. Both are bacterial STIs that can alter discharge, typically making it more yellow, cloudy, or increased in volume. Both infections are frequently asymptomatic, especially chlamydia, meaning many people don't notice any discharge change at all. The real danger with these two isn't the discharge itself, it's what happens if they go untreated. Both can ascend from the cervix into the uterus and fallopian tubes, causing pelvic inflammatory disease, which can lead to chronic pelvic pain and, in some cases, fertility complications. This is why any unusual discharge combined with pelvic pain or bleeding between periods should never be ignored.